Adjust your television set. It's not you. It's because of where we are at the water purification plant here in Bushbuckridge. That's what's making the sound in the background. So nothing wrong with your television set. It's just the signs of exactly where we are and the work that's happening behind the scene to try and deal with water issues in Mpumalanga. We spoke about that. We covered that topic. We then moved on to issues of health, and that's where we are right now. We heard from the ANC's David Mahlobo with regards to the work that the ANC is doing to deal with health-related issues. But, of course, the opposition wants to weigh in on that debate. So let's hear from the APC's Themba Godi. Let's find out from you. You heard from the ANC. What's your reaction?
Yeah, I think, Ayanda, the problem with healthcare is not so much resources. If you look at the national budget and even the provincial budgets, there's a lot of money that is being pumped in, but it is the management of those resources. If you look at Tintswalo Hospital in Akonuk, or Matikwane here in Mkotlu, as well as Rob Ferreira, they are almost dysfunctional. So if we don't deal with management of the resources that we have, we're not going to improve healthcare. However, and I will be glad if Comrade Mahlobo were to respond to that, the issue of lay councillors and home-based caregivers, why are they not employed permanently by the department? Because the work they are doing will forever be with us, and yet they are employed through NGOs, and they have problems of payments, their employment conditions, which affect the quality of services that they render to the most vulnerable people. And as the APC, we have raised this with the National Department, and we're not getting a very firm answer. And yet we see lay councillors and home-based caregivers, rising up in all the provinces, saying our working conditions are appalling, and yet we are dealing with the most vulnerable people in our society.
20 seconds to respond to that, Mr. Mahlobo.
Well, our health plan, it has a 10-point plan. One of the biggest issues we're addressing there, one is the issues of human resources. As I've indicated, we have started with the first phase with the professional, the administration. We are going to all those other phases. Infrastructure issues, we are spending a lot of money. Even in our manifesto, we are going very big bang to address those fundamentals to make the health system to work.
Mr. Ndlovu, I just want you to hear from you, and I know we can go on and on about that, and he didn't speak about the lay councillors and some of the people who do home-based care, but I'm going to have to leave it there because there'll be a lot of toing and froing if we don't hear from the Congress of the People. Mr. Ndlovu, if you were in power tomorrow, or come the May 7th elections, if you were to take over, how would you change things for the better with regards to health?
One thing we are going to do, we are going to devolve powers to CEOs of hospitals so that they can be able to hire staff, they can procure your medication, they can be able to get all the supplies that are required in hospitals. As I'm speaking to you now, a CEO of hospital has got no powers. Procuring just a toilet paper, you have got to write to the head of department to give you a tissue in a clinic. We will make sure that clinics have got doctors, because you have got big clinics like Tula Mahashi. There are a lot of communities, almost close to 30,000 people who are relying on that one. But there's shortage of nurses. We will hire nurses there to make sure that they are able to provide services to our people. We will cut on the queues, the turnaround time for a person to be in a clinic or hospital. We will make sure that it goes down to at least an hour, unlike at the moment where their own intentions is to have them, the turnaround time to be about 5 hours, which is a very long time. Congress of the People will make sure that the procurement drugs are not procured through service providers. We will make sure that there is a direct link between government and the producers of drugs, because that will make the drugs cheaper, unlike the tendering system that is used in that regard, where you go to Tintswalo, you only get a Panado, and other hospitals. So the Congress of the People, in its national plan, in its health plan, we will ensure that we overhaul the whole system, your infrastructure in hospitals. If there is an electric fault in a hospital, you need public works, which is very far away. We'll say bring all the skills that are required, like
so
in your private.
A lot of bureaucracy. You'll do away with bureaucracy,
and make sure that our hospitals function as completely like in the private sector.
I'm going to ask you whether or not you agree with that, and if you can expand on that as far as the NFP is concerned.
The NFP is saying, Ayanda, firstly, we shall deploy people not according to being the card-carrying members of that particular party. The general trend wherever the ANC is in government throughout this country, is that they will deploy their cadres who are totally incompetent. Sometimes you'll find that in most of the health facilities in the country, the only thing you can find in their shelves is Panado, other than the medication that people are acquiring. Now we want to stop that. We will deploy people who are academically qualified to render the service delivery that people need. Because so many people have died in most of the hospitals in this country. And after 20 years, it's very difficult for me to contemplate that the ANC is still talking about the new policies that they are implementing. It means people of South Africa must wait another 20 years over and above the 20 years that we have seen. Really, this thing must come to an end. The NFP will make sure that we shall revamp the whole system of government after the 7th of May.
Panado malapha konke for everything.
Yeah,
absolutely.
Let's speak about intra-party politics now. I can't shy away from that. Opposition parties accusing the ANC of taking whatever party squabbles they have for power. I know they were at their height in 2010 or so. We saw mysterious murders, we saw disappearances as well, and people blaming ANC officials and the struggle for power internally for that. Of course, it's unsubstantiated. It hasn't been proven in a court of law, but that was the sentiment at the time. It seems to have subsided somewhat at the moment, not reading much about it in the headlines at the moment. But I have to ask whether or not internal party issues and succession debates when it comes to the province and the party in the province, is that spilling out and affecting service delivery?
Well, the opposition has nothing to say good about the ANC. They have no story to tell. These people that are speaking about the ANC, they are not in the ANC, they are speculating. The ANC is very strong in this province, led by the capable provincial chair, Comrade Didim. If the opposition, there were problems, we're not going to win all the wards in the province if you look at all the municipalities that are here. Right. Currently, I can tell you there are issues of disagreements within the organization. It's a big organization, but we remain strong and united. And on the 7th, we are going to demonstrate that the ANC...
We'll have to see that come the 7th. We're going to leave it there for now. We're going to continue with this elections debate after 8 o'clock. If you do have access to DSTV channel 404, make sure that you stay with us as we thrash out those issues and go a little bit deeper below the surface. But right now, to our SABC2 viewers, thank you so much for having joined us for the last 2 hours. We say goodbye. God bless from Mpumalanga.
Sure. Well, there you have it. Nice heated discussion happening in Mpumalanga.